If you suffer from sleep-disordered breathing, you might suffer from pauses in breathing during sleep, loud snoring, choking, or gasping during sleep, memory, learning, and concentration problems, and mood swings, irritability, or depression. Each of these symptoms can put a big damper on your day and health, which means treatment is vital and necessary. Do not ignore sleep apnea. With proper education, you can understand this disorder and get your health back on track. And, let's face it, to help you get a better night's sleep. Phew! We have seen through evidence that upper airway collapsibility is the underlying cause of obstructive sleep apnea, OSA, and snoring, collectively referred to as sleep-disordered breathing, SDB. There is an array of treatment options currently available, but oral appliance therapy has proven to be highly successful for patients with mild to moderate sleep apnea. Through oral appliance therapy, we are able to change your health by significantly improving your sleep-disordered breathing. It's quite the relief when treatment can be so simple. Oral appliance therapy even helps to eliminate snoring, which is always a positive benefit for bed partners. Take charge of your health and give us a call at 678-899-6076 or visit us at www.alternate2cpap.com.